Dental implants are a good replacement with missing or failing teeth because it gives you back something pretty similar to natural function. Most common things I've seen with dental implants done somewhere else, a lot of implants are placed really close together. I see a lot of bone loss around implants that have just been recently placed as well. And I see a lot of breakdown in the materials used for the final teeth. These are some of the biggest problems that I see where each case is just done the same. Not every patient needs a bunch of bone reduction on the top and on the bottom. And so within the first 4 or 6 months, I see dental implant failures from other places, for sure. The way I avoid some of those issues that I see from other places, I don't place the implants so close together. I'm not afraid to use different bones in the skull, as I'm fairly familiar with the anatomy of different areas we can use to get good anchorage for implants. I also have fairly advanced training. I mean, I did another 3 years after dental school, so I don't just tell you here's 4 implants top and bottom. The smile design process, or the smile that we end up getting you, it really depends again on what your goals are and what your expectations are. Sometimes I need more implants, or sometimes I need a little bit of grafting or soft tissue augmentation. The biggest thing that helps me is taking a 3-dimensional x-ray. So I know where the infections are, where your sinuses are, where your nerves are. So it helps me plan your case in terms of avoiding certain pitfalls and getting you the best result that's possible. It also helps me tell you what I think is going to be possible based on your anatomy and where your bone levels are. Patients are afraid to get implants sometimes because they think it's going to hurt a lot. A lot of that depends on what was done. Some patients go back to work the next day. Some patients take a week off from work or whatever they're doing. The other thing I see most common too is going to be cost. Patients are wondering how much things will cost to get an all-on-X procedure, even a single implant, for sure. Personalized care is important when it comes to implants because it'll take about 4 or 5 visits throughout the span of 6 months until we have your final teeth. So I think it helps if you know that your doctor is there and will be there for you in a pinch if you have an issue. And then if you have questions along the way, you don't have to hesitate to ask. So I place roughly 1,200 implants a year, and I'm about 97-98% successful. I definitely have implant failures. Sometimes it's just difficulty cleaning. You end up getting a little bacteria around the implant, and so we got some bone loss. But if that were to happen, I'll always redo something at no charge. Happy to do that. Just stand behind what I do. It's not like there's a 1-year warranty on this and then you're out of luck. So definitely stand behind what I do. If you're nervous about getting dental implants, it can't hurt to get an evaluation to see what's going on. The longer you wait, the harder it can be to get you back implants. And again, it's complimentary, so the scans, the photos we take, it's all complimentary, but as long as you have enough information to make a decision, I'm okay with whatever you end up doing going forward.